Hello coders! Welcome to Fast Coder 21 free medical coding YouTube channel. In this session, we are going to learn basics of interventional radiology. Usually we'll call it as IVR in medical coding. If you want to know latest updates in the world of medical coding, please subscribe to our Telegram group. The link is provided in the description of this video. So first question, what is IVR? Usually we will call IR, also known as vascular and interventional radiology or surgical radiology, is a subspecialty of radiology providing minimally invasive image guided diagnosis and treatment of diseases in every organ system. So basically IVR uses radiology and minimally invasive image guided technology. So in order to treat diagnosis in the every organ system, like IVR used in the cardiovascular system, urinary system, and gastrointestinal system, and few. If you are visiting for the first time, please subscribe to our channel in order to get latest updates in the medical coding. Please watch until the end in order to gain more in-depth knowledge about IVR coding. So who is an IVR coder? So IVR coders read the reports generated by the interventional radiologist in order to provide codes using ICD-10-CM, PCS and CPT. So as usual, IVR coders will use ICD-10-CM, PCS and CPT. IVR coders can specialize in radiology and interventional radiology. This is because these are complex rules of coding and mistakes can be costly. So basically, every coder can't do IVR coding. So IVR coders are specialized in radiology and interventional radiology. So what is diagnostic and therapeutic radiology? So what is diagnostic radiology? The art or act of identifying disease from its signs and symptoms. So using diagnostic radiology, we will find the disease using signs and symptoms of the patient. So what are the common diagnostic radiology? X-ray tests, all diagnostic laboratory tests and other diagnostic tests furnished to beneficiary. So most of the common diagnostic radiology process is X-ray. What is therapeutic radiology? So the attempted remediation of a health problem usually following a medical diagnosis. So basically after diagnostic radiology, physician will use therapeutic radiology in order to provide remediation to a health problem. So what are the components IVR? So basically in IVR, we have two components, the surgical component and the radiological component. What is surgical component? The process of involving manipulating the anatomy to reach the intended outcome. So in order to gain in the intended outcome, we will use the surgical component. So what is radiological component? The process of involving utilizing radiological images to reach the intended outcome. So in order to reach the intended outcome, we will use radiology or radiological images to reach the intended outcome. So without radiology, we can't provide or we can do interventional radiology. So what are included in IVR? Basically, IVR include two sections, surgical codes and radiological S&I. So what are the common surgical codes? Vascular access, catheter placement and interventions like thrombectomy, stent procedures and angioplasty. So which we are going to learn further. So what are radiological S&I? Image guiding and image taken, interpretation of films. Physician must supervise and interpret in order to code radiological services. Append modifier 52 if only one portion of service provided. Hospital coding report S&I whether performed by same or different physicians. So if the service is provided one portion, we need to use 52 modifier. So what are the types of radiology technologies performed during the IR procedure? So usually during the IR procedure, physician will use traditional X-ray, ultrasound, MRI and MRA, CT and CTA. So what are the vascular systems included in IVR? So basically we have 5 vascular systems included in IVR, which are arterial, venous, otherwise veins, and pulmonary system, portal and lymphatics. So arterial and veins related to cardiovascular system, pulmonary related to pulmonary system, portal related to gastrointestinal system, and lymphatics related to everywhere. As So each system is having separate guidelines. So each one of these systems are having separate guidelines. So in order to code properly, we need to know the guidelines related to separate systems. Like if you are coding pulmonary system, you need to know the pulmonary IVR coding guidelines. If you are coding lymphatic system, you need to know the IVR guidelines related to lymphatic system. So these 5 systems are having different guidelines. So while coding IVR documentation, what are the keywords need to check? So basically whenever we code IVR documentation, we need to check catheter insertion point, catheter end position, vessels catheterized, vessels visualized, abnormal anatomy, and also we need to check what is the procedure or therapeutic procedure performed. For example, if the physician is performed angioplasty, stenting, atherectomy, or embolization. So what is a vascular family? So primary branch vessels, vascular family consists of number of family. As we have learned previously, like vascular, arterial, venous, portal, and pulmonary and lymphatic systems are included in vascular family. So primary branch vessels, vessels that arise from a single branch from the aorta or vena cava. So basically vascular family starts from aorta. So first order vessel that arises of the aorta or vena cava. Second order vessel that branches off from a first order vessel. So basically second order originates from first order. So what is third order? Vessel branching off from a second order vessel. So basically third order originates from second order. So first order arising of the aorta are left subclavian, brachiocephalic, left common carotid. Second order arising of first order vessel are right subclavian, right common carotid. So for example, if you see the documentation here, this is left coronary artery, right coronary artery. This is the thoracic aorta. Here this is the arch of aorta. You can call thoracic aorta also. So left coronary artery and right coronary artery. So here first order includes brachiocephalic artery, left common carotid artery, left subclavian artery. So these all are first order vessels. So these are comes out from the aorta. This one brachiocephalic artery directly comes from aorta, and common carotid artery also direct came from aorta, and left subclavian artery also directly came from aorta. So for example, if you take brachiocephalic artery, it divides into right subclavian artery and right common carotid artery. So these are the second order vessels. So these second orders divides into third order vessels. So what is selective and non-selective catheterization? Basically, non-selective means physician is going to insert catheter in the aorta or vena cava. He will not go further the aorta. So what is selective? So in the selective catheterization, physician will manipulate the catheter out of the aorta. So how do you code selective and non-selective catheterization? So once a catheterization is selective, the non-selective catheterization is inclusive. So whenever there is a selective catheterization performed by the physician, we will or we no need to code the non-selective catheterization. Basically, non-selective catheterization included in the selective catheterization. we need to code each axis. For example, bilateral axis or upper or lower extremity axis. If the physician performed or uses two axes, we need to code separately for each code. For example, catheter is placed into the right upper extremity and into the aorta. This is non-selective. We did not select a vessel of the aorta. 36200. So basically here physician inserted the catheter only into the aorta. So this is non-selective. So then physician manipulated the catheter into the right brachiocephalic innominate. So this becomes selective and we will omit the non-selective code 36200 and we can code 36215. So basically non-selective converted into the selective catheterization. So then from the first order the physician manipulated the catheter into the right subclavian. So this is the second order and we want to capture each selection separately. So here we need to code 36216. Then physician manipulated the catheter into the right internal mammary artery. This is the third order and we want to capture each selection separately. This is 36217. So here we need to code 36215, 36216, 36217 as 15 is first order, 16 is for second order, 17 is for third order. So how do we code venous studies? So basically code selective inclusive of non-selective, just we have learned. Code each vascular family to the highest order selected. So for venous studies, we need to code highest order selected. For example, in this above scenario, we need to code 36217 if it is a venous vessel. So each vascular axis is coded separately. So additional vascular families that are catheterized code separately. Add-on codes are assigned as indicated. So what are the common therapeutic interventions? Most common one or basic one is angioplasty. Angioplasty means basically it is repair of the vessel. So angioplasty and stent. So angioplasty also called balloon angioplasty is a procedure that opens arteries to let blood go through more easily. So basically using the angioplasty, physician will open the clogged arteries. So latest angioplasty procedures also involving inserting a short wire mesh tube, usually we will call it as stent, into the artery during the procedure. The stent is left in place permanently to allow blood flow more freely. So whenever there is a necessity along with the angioplasty based on the patient's condition, physician may also insert a stent. So this stent will be permanent and it will reduce the clogging of the blood flow and it will provide free flow of the blood. So what is atherectomy? So atherectomy is a minimally invasive procedure healthcare providers use to remove plaque buildup and open narrow or blocked arteries. So atherectomy means removal of plaque. So it is a minimally invasive procedure. In order to remove plaque, physician will perform atherectomy. So we have four types of atherectomy. Excisional atherectomy, a blade cuts plaque in one direction. Laser ablation atherectomy, here a laser destroys the plaque. Orbital atherectomy, a spinning tool works like sandpaper to remove plaque. Rotational atherectomy, tiny blades cut plaque in a circular motion. So next therapeutic common procedure in IVR is embolization. So embolization procedures stop blood flow to a specific blood vessel. So treatment works by placing a substance in the vessel to prevent blood from flowing through it. So in order to stop the blood flow to the other organs and based on the patient's condition, physician will perform embolization where physician will put a substance in the vessel in order to stop the blood flow. Next one, thrombosis. So thrombosis happens when a blood clot thrombus forms locally in a blood vessels and slokes or blocks the flow of blood. There are two types of thrombosis. So venous thrombosis, arterial thrombosis. So if there is a thrombosis in a vein, we will call it as venous thrombosis. If the thrombosis is in artery, we will call it as arterial thrombosis. So next one is thrombolysis, also known as thrombolytic therapy, is a treatment to dissolve dangerous clots in the blood vessels, improve blood flow, and prevent damage to tissues and organs. So lysis means destruction or so embolism. An embolism is any foreign substance that moves in our bloodstream until it blocks a blood vessel. So an embolism is often caused when a thrombus or piece of thrombus breaks off from where it formed and travels to another area of our body. So basically, thrombus is the uh, accumulation of blood and forming a blood clot. So whenever thrombus breaks into small pieces, it converts into embolism. So embolism is having a characteristic of free moving. So when there is the opportunity, embolism moves into the arteries and it will block the arteries or blood flow. So common embolism related conditions are stroke and pulmonary embolism. So next one is dialysis graft declotting. So declot is a common interventional procedure that occurs in arteriovenous fistula and graft. A declot is done to remove any clogging or narrow passages in arteriovenous fistulas and grafts to improve blood flow. So next one, what is ipsilateral and contralateral? So basically ipsilateral means same side of the body, contralateral means opposite side of the body. So next one and last one, what is the AAPC CIRC C certification? So basically AAPC's CIRCC certification, which usually call it as Certified Interventional Radiology Cardiovascular Coder. So this certification is useful to the people who are working in IVR coding. So everyone can't write this CIRCC. It is very complicated or complex certification. Only the people who are having experience in IVR or cardiovascular coding can write this certification. See here, CR certification demonstrate proficiency applying correct CPT and HCPCS level 2 codes as well as modifiers for interventional radiology, cardiovascular services and procedures. So if you see these are the requirement. So if in order to write say RCC, you need to know diagnostic angiography, non-vascular interventions like biliary procedures, biopsies, ablations, spine interventions, percutaneous vascular interventions, diagnostic cardiac catheterization, basic coronary arterial interventions, basic coding, medical terminology, anatomy and physiology. So here exam format is 100 multiple choice questions, online or in-person options. You can write online or in person. So in person, time allowed in person online exam administered in one sitting with 4 hours to complete the exam. So you have 100 multiple choice questions and you need to complete in 4 hours. So equipment required for online exam, a reliable internet connection is mandatory. Experience requirements. So high level knowledge of interventional radiology, cardiovascular related medical terminology, anatomy and pathophysiology, along with understanding of the proper application of CPG procedure codes and ICPICS level 2 procedure codes and supplies. So in order to write this examination, you need to have IMA CPT, ICPICS level 2. And also maintaining your certification, you need to give 36 uh, CUs, pricing one exam attempt $400, two attempts $450. So in appendix L we have vascular family. If you see here, so this is the arterial vascular family. So if we are going down, this is the venous vascular family related to veins, and first one is arteries. Next one is arterial vascular family, thorax and abdomen. So in order to code IVR, you need to be know all these things. So vascular family, thorax and abdomen. So as of us know, in every region we have vein and artery. So arterial vascular family, abdomen detail, venous vascular abdomen detail. Here arterial vascular family, upper limb. So upper limb, these are the arteries. Vascular family, upper limb. Here we have lower limb. And detail both are vein and artery detail, arteriovascular family, head and neck, vein, head and neck. So in order to know arterial family properly, you need to see this vascular family in appendix L. Thank you guys. If you like this session, please click on subscribe button to receive future updates and also comment, like and subscribe to Fastcoder 21. Happy coding guys. Please join in our Telegram groups in order to know more medical coding updates.